So thank you everyone for sticking with us, or if you're catching up after the conference took place, thank you for joining us to hear the session. This is the final panel session of the conference. I don't know about you, but I'm increasingly intimidated as I listen to the previous speakers and the brilliance of the chairing. This panel is really the final panel session of the 3 conferences that we've run focused on COVID partnerships. So many of you are involved in all of them. But do you remember those days? It feels like another era, doesn't it? April 2020 was when we organised the first conference. So from a UK perspective, we were about 1 month into the COVID lockdown experience. And the one thing we knew was solidarity mattered to us, that partnerships had a role to play. But we weren't absolutely confident about that. And so the first conference was very kind of exploratory. What can we do? What value can we add now that we're not allowed to get on airplanes, we can't leave our own homes? How on earth can we communicate? So I'm very excited to be chairing this final session. The contents will help inform the report that we'll produce. You'll have seen we've produced reports after both the first and the second conference. And we'll do so again in the determination to try and learn the lessons, the useful lessons about how we can go forward. So I'm going to ask each of our wonderful panelists 2 rounds of questions. I'm going to start with Dr. Shams Syed. Thank you, Shams. You've been with us all the conferences, as you have been in so much of the life of institutional health partnerships. We're absolutely in your debt. I was rereading Ed Kelly and his remarks in 2020. I was listening to Rudy Eggers earlier today. The themes of, do we risk derailing the quality healthcare agenda? Do we risk not applying the important lessons around compassionate care? Reflecting on this conference, what do you think? Have we learnt those lessons? Have we avoided making those mistakes? Are there particular highlights of what you've heard today that you wanted to draw attention to?
Thanks very much, Ben, and it's an absolute pleasure to be with you and all colleagues today. It's a difficult question to answer, and as usual, in the quality of care arena, nothing is quite good enough because it's a continuous journey, right? So with quality of care initiatives or quality of care work, it's always going to be an agenda that needs to be continued, and the burning platform for action always has to be readily available for colleagues to take action where it matters most, and that's of course at the point of care. And one of the things that perhaps really jumped out from some of the perspectives that were shared today is how can partnerships help in simplifying and demystifying quality of care issues at that point of care. With all the pain that we've gone through in the last few years, there have been some positive aspects that we need to hold on to. And one particular positive aspect is how attention to improvement methods and approaches at the point of care, at the facility level, needs focused attention, both in the context of dealing with an outbreak and but also when we're faced with the public health emergency. And it's not just about, we continuously reiterate this, it's not just about reiterate this, it's not pain, it's access and quality simultaneously. And that's really, really important to focus on. And then the point that you make about compassion is a really important piece that is at the heart of partnership-focused approaches. And I really do believe that the partnership community can be a real champion and driver for compassion because if you take a pause and listen to any of the partnership experiences that were highlighted today, if you take a pause and you listen with compassion, it changes the nature of the conversation and it changes the nature of how we feel about each other, irrespective of where we are based on this planet. So just a few initial thoughts there, Ben.
Thank you so much, Shams. Really appreciated. And if I may, I'll now turn to my colleague, Dr. Shiba Gita, who's the director of THET's Uganda team. Shiba, I really loved the global nature of this conference, the fact that we're hearing voices from all corners of the earth. But it's particularly the voices of our colleagues in Africa and Asia, those in low middle income countries that I've been focusing on. What can you sort of highlight some of what you've heard from those voices about during this conference and some of the lessons you think that we could learn from what they've had to say, please?
Thank you, Ben, and good afternoon from Uganda. One of the key things I think that has been rhyming is the issue of willingness and commitment to work together as being very important as health partnerships are addressing, as we're addressing COVID or as we go ahead to address any health system challenges. It's going to be really important for us to have that willingness and commitment by all parties to work together. And I think Thin put it really well when she mentioned that, well, there's always the issue of working across borders, the physical distance. But if there's that shared commitment, then physical distance stops being a challenge because then we can harness the existing technologies and use those to address the issue before us. Yeah. I think the other issue that struck for me was something that Noah raised on the need for us to build resilient health workers. I thought this was very important because oftentimes we talk about building resilient health systems. This is a theme that has been running across so many conferences, but we oftentimes forget the individual, who is the health worker, who is central to these resilient health systems. And I think COVID has really highlighted the need for us to invest in the human resources, making sure that they are well, taking care of their psychosocial needs, to ensure that then we build resilient health systems.
Thank you so much, Shiba. And we're also joined by Bruce Compton. I'm very grateful to you, Bruce, joining from the United States. Bruce is the Senior Director for Global Health at the Catholic Health Association of the United States. And Bruce, I'd love you to share your impressions of the conference, please. And I know you particularly, I think, for your strong emphasis on ethics and equity in partnerships. And I'm wondering whether you agree with me that that's been one of the standout themes of the conference so far.
Absolutely. Thank you, Ben. Thank you for this opportunity. I'll say it's been an excellent conference, even though you make me get up at 3:30 a.m. in the morning. You know, I go back and I've been to several of these conferences in person, and this is my third one that you've done virtually. And I really love the progression that these have taken. In 2020, we learned we talked about needing to learn rapidly and get back to some of the basics of WASH, infection prevention and control, learning from others. And we heard about that context matters, and we need to develop specific approaches based on the resources that are available to those locally, and sharing our knowledge of best practices. Then in 2021, all of those themes were reiterated, but we heard more about the continued stress on the health system for primary health care, and continued to urge us using our strengths and using our voices together to advocate for things like vaccine equity. And as we continue, we're in this endemic phase, we have to continue to learn those lessons. And that's been so important in what I've heard today, is that continues to happen. And to me, to your point about equity and ethics, we're really getting down now to, as we learn, we really have to be thinking about equity and ethics. So today we've heard about how much partnerships have transformed to meet the needs. In the very first session, the nurse midwives from Israel and Pakistan provided insights into how connections and sharing expertise have really made new things possible because of technology and innovation that have been expedited because of this COVID pandemic. We've also heard a lot regarding the struggles of how how partnerships have flexed to continue to provide assistance in the most appropriate ways given the circumstances. Again, using that technology, using specific funding, and once again, focusing on those specific needs. I think some of the key messages that we're hearing are, I'm quoting someone from earlier. I did not write their name, but nothing about us without us. That's about ethics and equity. Keeping your partners at the center, that's about ethics and equity. And we're always better together. And I also think Sham's continued conversation about quality and compassion work right into that. I think the future, we also heard that Britain say the future of global health will include virtual and travel where possible and most useful. And I know that the environment and our carbon footprint is important to all of us, and especially to you at THET. And so understanding how we move that into the future, again, thinking about those very important topics in our world. And I think, acknowledging that health systems and the primary healthcare are key, but those global investments in these issues need to match our understanding and recognition of those issues, ensuring that the health workers are at the center once again. And I'll close by saying Goran mentioned that the history of colonization and the move to localization is so important. Francis reiterated that in his talking about starting with local. I also want to say that CHA has very much dug into recently in a US-based colloquium about the common good. One of the topics was appropriate and ethical recruitment of nurses from low and middle income countries. And that is something I will continue to add to the issues here at CHA. And finally, Britain mentioned the Brochet Declaration and its principles for appropriate global health partnerships. And I hope, Ben, that I'll have time to talk a little bit more about that in my second question. So thank you.
That would be excellent. And I want to talk to you more about the workforce migration and the ethical work that you've been doing with regard to that. You saw that Francis and at Achest and FET are very interested in that. Do put links, by the way. The Brochure Declaration is in the chat box, and you can find it, people, if you look in the chat box. I'm now going to turn to Joe Burns, who is representing Healthcare UK. Joe, interesting fact, you're the only speaker from government this year. So not only do you represent the UK government, or Healthcare UK and DTI and the UK government, you represent entirety of government. So Joe, thanks for joining us. And I'm just fascinated to hear your impressions, please. And I suppose I'm a little bit biased. what did you find that you felt we were able to celebrate over the course of this conference?
Yeah. Well, thank you for the introduction. As a Belfast girl, I'm a little bit conflicted about the idea of being the sole representative of the UK government, but I think we'll carry on. This is my first conference that I've attended, so I think the first thing that I really wanted to say was how humbled I've been listening to the experiences that people have been talking about today, and really by the compassion and care that's been delivered across the globe during the pandemic. So that I really wanted to start off with that. I think a key take home for me is the role of solidarity amongst the global healthcare workforce. And I think that really came across in the last session. But I think that's key to effecting change and in tackling the key global challenges that we face. The last session really highlighted the need to capture and act on lessons learned during the pandemic. And I really hope that work continues. So for me, that was a real key take home. We also heard about the need to harness the enthusiasm for international partnerships that have been evident during the pandemic. I think Navina first spoke about that when she gave her introduction to the session this morning. And I think that's a real key point that has come across. We also heard from Sana and Gila about how the pandemic has supported peer-to-peer networks. Particularly, they spoke about the midwifery and nursing networks. But I think more broadly, there was a message about how virtual global networks are able to amplify the voices of the healthcare workforce in ways that maybe wasn't the case before, and how that's an opportunity for the healthcare workers from all disciplines to step forward into a place of leadership. So I think that has been a theme that has been woven through the whole of the conference. So just a couple of more from me, really. I was really struck around the need to commit to global partnerships, and to, following on from this, to start to think about practical ways of sustaining that sense of global belonging that has come to the fore. And I think everyone's touched on this a little bit, but the real need to look at the interconnectedness of the global healthcare workforce, and the fact that health system strengthening brings collaborative benefits and collective benefits. So or it's again, feeding into that all health is global health aspect. And I think for me, the conference today has really showcased and given us case studies of why that's important and what's being done. And then I think the final thing is really, I've heard about the learning that's been generated during the pandemic and over the last 3 years. And crucially, many speakers have mentioned the need to use humility as the gateway to knowledge. And I think that's really important, as is the kind of shared learning. So we've heard from Somaliland on how joint endeavour and rapid information exchange was able to save lives during the pandemic. And we also heard from Cali around how shared learning benefits all partners. So it's that sort of reciprocity of learning and the real benefits that it generates across the system, both north and south. So it's not just about donor and recipient; it's about the shared learning that we can all benefit from. So I think for me, those were the sorts of key themes that I heard today, and the real causes, the things to celebrate and the things to make sure that we don't lose. There's been a lot that we've gained has been very hard won, and we really don't want to lose it.
Yes, absolutely. So thanks so much for that. And I think people are scribbling away, writing down every one of those insights that we'll use in the final report. I'm going to shift gear now look forward and say, and ask questions around, what are the things we want to keep hold of going forward. Sheba, can I come back to you? And, from your perspective, working for THET at the heart of the health partnership community. What do you think we should absolutely bear in mind as we fail forwards? That wonderful phrase that I had to Google, if I'm honest, which was the title of the first session of this conference. What are the things you think we have to hold on to as we fail forwards, please?
Thank you, Ben. I think mutual respect and reciprocity is going to be very important because this is going to address the issues that come up with power dynamics. And then also the fact that COVID has shown us that while health in one place is really global health, we also have our unique attributes and needs in each setting. And what mutual respect does and reciprocity is, it allows us listen and ask the right questions without any biases. It helps us address issues with an open mind. And from that perspective, we are able to also be open to joint learning, because we are not coming in with any preconceptions on how we need to address issues. All we are doing is coming in because we know there is a shared need to address issues, but we are equal partners, and we say, let's sit around the table and discuss what's the issue and what are the resources at our disposal, and how best do we harness these resources to be able to address the issue at hand, and use that opportunity to have our eyes, our ears open, and pick up lessons that we can apply not only in this current setting, but be able to take back to our respective institutions and settings and be able to scale them up. And then it's also going to be really important to document these things so that we are not addressing issues from the scratch each time we encounter a problem. I think we lose a lot of time because we do not document and learn lessons from the past. So if we can do a good job in documenting and being able to draw lessons from the past, we are going to utilize resources better. We are going to be able to address issues faster, and then we are going to avoid making the same mistakes over and over again. And as somebody said, we need to always remember there's a human being at the center of whatever we are doing. So when we make a mistake, it's not a simple mistake. There's somebody that is being hurt. So if we approach all our interventions from that perspective, I think we are going to make more progress. So let us have that mutual respect and reciprocity. And then the other is flexibility and adaptation. I think that is something else that has come up. We come in with our plans, but the realities on the ground are ever changing. So we need to maintain flexibility to be able to adjust to the issues on the ground, because the whole intent is to solve a problem and not necessarily to implement a plan as was initially designed. I think we should always keep that at the back of our minds. Thank you very much.
Thank you so much, Sheba. Wonderful. And Joe, can I come back to you? It's wonderful you're here, representing Healthcare UK, full of ambition to contribute globally to the development of quality UHC, the theme that we care about. Could you talk a bit more about, from your perspective, how you want to engage globally going forward?
Well, I think from the perspective of Healthcare UK, I think what we really want to do is make sure we kind of harness the fact that the NHS has always worked collaboratively internationally, that it's a long history of doing so, whether that's been in sort of clinical and research networks, in professional networks, and even in community and diaspora networks. So working internationally and working globally isn't something that's new to the NHS. But I think what we want to do in Healthcare UK is really allow each NHS organisation to find their way. So for some NHS organisations, they will want to be very much involved in aid-funded projects, and that will be their priority, and that will be where they focus their resource. For others, it will be expanding existing networks that are already there, that they already have, which are, again, those clinical and research networks. And for others, it will be about growing a commercial portfolio of projects, which will be more a sort of on that line between aid at one end of the continuum and trade and the other. It'll be much more focused on the trade. But I think those NHS organisations which do see that kind of commercial portfolio development as something they want to do, I think they're very much focused on being there for the long term, for creating long-term enduring relationships. So going beyond the project specific aspect. So I think for me that's the key. The key benefit that Healthcare UK wants to bring, particularly the NHS Export Collaborative, which is it's the team that I head, which it is really around that collaborative working and increasing the capacity and the capability of the NHS to support health systems strengthening across the world. So whether that's through support for training and education, we've heard a lot today about how virtual education and training has really taken off during the pandemic and how that's really helped to forge clinical relationships. Or whether that's moving beyond that to supporting second opinions, to providing sort of expert services. So I think there's a range of ways in which the NHS is keen to engage internationally and will engage internationally, and it's really about supporting that in all of its forms.
Thank you so much, and what an exciting prospect that is. As we were saying to each other the other day, 1 in 7 of NHS staff were born overseas. It's international to its core, isn't it? As you just said. But what you're able to do is perhaps organise it, structure it in a more formal way, which will reap the full value of that global engagement.
And really be that matchmaker to match the right projects and the right opportunities to the organisations that are really willing to provide the resource. It's a bit like the journey that we undertook when NHS organisations first started to undertake research. What became really clear is that high quality care was delivered by organisations that took part in research, and I think the same it can be said for international work and global work, that those NHS organisations which take part internationally, which think globally, as Navina said, think globally but act locally, they are delivering high quality care. So there is mutual benefit in the international work that the NHS undertakes.
Thank you. By the way, people, go to your digital event bag and you can find further information about what Joe is talking about. I'm going to come to Bruce and then finally to Shams. But Bruce, you mentioned the brochure declaration. I'm also wildly excited about advocacy for global health partnerships, because I just think what you're doing there is movement building, is helping us organize ourselves on a global scale. And this conference surely reminds us of the value of getting organized on a global scale. So could you talk a bit more about both the declaration and your ambitions for advocacy for global health partnerships, please?
Yes, absolutely. And thank you again, Ben. I want to go back to your last comment on the last session, which was about the nursing recruitment. And I was there in 2019, I guess, when you launched the paper from competition to collaboration. And it really got me thinking about this, and have read the work you're doing from Drain to Gain. And I do want to continue that conversation. I also want to take this opportunity to say, I write a column for CHA's journal, and I think people that are on this call would be great contributors to that column for issues like that, and like the advocacy for global health partnerships in these. So if you're interested in that, those are opportunities that I think any of you that have issues related to what we've talked about today could be highlighted in a future column. Advocacy for global health partnerships. Ben, is a coalition that came together 5 years ago now as part of a side event at the Consortium for Universities for Global Health, really bringing together like-minded people who had been involved with what we call short-term medical missions and trying to really improve the principles, the ethical issues around those. And it has really evolved its understanding from focusing on short-term medical missions to really thinking about how do institutional partnerships and short-term medical missions come together. We have worked with many of the organizations that have been present here today, including Dr. Weekliam, Dr. Omaswa, yourself, Ben, Dr. Syed, who's on this panel, and many others, to help develop a framework of principles for moving forward in those global health partnerships. And we are going to be in 10 days meeting in Geneva with some of the in-country partners to really get their perspectives and to take it to the next level. But what we believe is that a well-functioning health system is really backed by adequate funding, strong health plans, evidence-based policies, and the appropriate resources to train health workers, to maintain the infrastructure, and to ensure a reliable supply of essential medicines and technology. And global health programs that are brought in from the outside that aren't resourced appropriately, that aren't rooted in the history and guided by an understanding of the local culture, have faced significant challenges throughout the years. We believe that effective partnerships can play a critical role in the areas of health system strengthening in primary healthcare. They can provide knowledge and technical exchange for the health administration and to help develop that health workforce. And so we worked with many global partners and developed the Brochet Declaration, which I put in the chat box a while ago. And it has 6 principles, and those are mutual partnership with bidirectional learning and input, an empowered host country, and the community defines the needs and the activities, sustainable programs that really work towards capacity building, ensuring that we are compliant with the applicable laws, ethical standards, and codes of conduct for these kind of interventions. And the 5th one is humility, which has been mentioned here, cultural sensitivity, and respect for all involved. And finally, the last principle is around accountability for our actions and measuring our impact. We really believe that based on these principles, we are committed to work towards bridging the multiple dynamics and the needs that have caused some of these difficulties in these global partnerships, and especially the short-term interactions. And we believe that through collaboration with and among high-income partners, low and middle-income country partners, our other multinational agencies like the WHO, we really commit to emphasizing all those appropriate ethical, legal, and regulatory standards, and serving as catalysts for effective and respectful partnerships that maximize the benefits to everyone. And we really intend to make this an opportunity for everyone to participate. And most importantly, much as you've done today, to make the voices of those from the places that we often say we're trying to help, to be the voices that are ones that are the loudest and heard the most and followed. Thank you.
Bruce, thank you so much. And all good wishes for the meeting in Geneva and for the work you're doing to build that sort of global movement, also by participating in this meeting. By the way, you have a clock behind you, which makes me feel very guilty. So also thanks for getting up.
I did that purposely for you, Ben, so you could see it's just now 9 a.m. and I've been on for 6 hours.
Yeah. So as I say, I hope you had lots of coffee. Thank you. I wanted to conclude with Dr. Shams Saeed, because Shams, I've said it before, but you've been such a guide and inspiration for us. And sitting at the World Health Organization as you do, you also set the standard, and you connect us together in the most wonderful ways. And you have been a presence throughout these 3 conferences and in our lives all the years I've been at THEP, which is approaching 7. And so I wanted to just give you the last words of this session, if I may, thinking about the future and how we confront it.
It's very kind, Ben, and it's a privilege to be with you all. 5 very quick points that I'd like to share. So the first one, which is actually really at the core of institutional health partnerships and the work that you all do, is the catalytic role of health partnerships. Catalytic for health systems. So I think we've heard a number of times that partnerships can do great work, but if they're not connected with the overall health system, then perhaps there's not the impact that it could have may not be achieved. So it's something just to keep in our minds as we move forward. The second is what partnerships do brilliantly is to work in grounded reality. And that reality allows the partnership often to penetrate policy dialogue. So the actions and the results from partnerships informing policy dialogue, so that policy dialogue becomes real with frontline experiences. The third one that I wanted to really highlight is real-time solution generation. So how do partnerships have a miraculous mechanism to develop solutions to practical everyday issues? That's the third really strong point that the partnership approach can further develop. The fourth one is really related to motivation. And we've heard many times throughout today the importance of not feeling that you're alone. So solidarity, motivation, and compassion at the heart of that. And then the fifth and final point, you will have noticed that we've used the same phrase throughout the 3 conferences that we've had an opportunity to share with you. Learning with humility, acting with intensity. Why do we say that? It's very, very easy to come with solutions rather than making sure that we're learning with humility. And of course, that learning is multidirectional. And I think the partnership community can be a very strong advocate, as have all of the speakers today, on ensuring that this learning is multidirectional. And we appreciate the fact that learning flows in all directions. This has been a phenomenal day, Ben, and thanks for the opportunity to share a few thoughts.
I can't improve on that. So I'm just going to say thank you very much, Shams, Bruce, Joe, Sheba, for giving us a national and international perspective. You've laid out the themes really for our paper that we'll produce following this. It's been an absolute pleasure. Thank you. We're going to have a short break and then we'll have a final keynote. And I'm estimating that we won't end at 3:30, but UK time, but slightly earlier. But do join us for the final keynote. Sincere thanks to the panelists for your contribution just now.